We've had a lot of people contact us this week, understandably concerned about Group A Strep, and so we thought we'd pull together this information video just to sort of run you through a couple of things that you might find helpful. And this has been understandably driven by the news articles that are coming through about the unfortunate number of deaths that are being reported due to Strep A. So I thought it'd be sensible just to pull this video together, and it will consist of three parts. The first part will be a bit of information about Group A Strep. The next part will be actually spotting a really sick child and what to look out for. And the last bit about, because it's often associated with tonsillitis, about sort of chatting through about when we would and wouldn't prescribe antibiotics. So Group A Streptococcus is, or Group A Strep as you sort of may hear about it, is a normal bacteria that sort of can live in and around your sort of nose and throat area. The issue comes when it goes where it shouldn't do and becomes invasive. So it can just live there normally, but it can sort of cause other bits and pieces such as a sore throat, flu-like illness, high temperatures, muscle aches and pains, and you may have heard of Scarlet Fever, which we'll go into a bit more detail. So Scarlet Fever normally presents itself with a tonsillitis type picture and a couple of other bits and pieces as well. Sometimes we get a strawberry tongue, which is a picture down below, and you can see sort of a red inflamed sort of tongue with some sort of papules on, so little red bits that makes it look like a strawberry, hence the term. The other one is what's called a sandpaper rash. Now, in sort of lighter skin, you may see a red rash with sort of raised and feels like sandpaper. If you've got darker skin colorings, you may just feel that roughness to the skin. When this is diagnosed, it needs to be treated with antibiotics. So if a clinician has seen you and said this is likely to be Group A Strep, ideally you should isolate for 24 hours whilst the antibiotics are kicking in. This certainly applies for school exclusion, though there isn't any sort of official guidance for adults. As always, it's transmitted by droplets within the air, so good hand hygiene, certainly if you've been sort of sneezing and disposing of those tissues. And also, it's not a bad idea to consider a mask if you want to. Don't be surprised, this is a notifiable disease, and what that means is that we might take some extra information from you just so that we can track the spread if it's confirmed. The problem cases is when the child gets really, really sick. And often it's not the cases that we're seeing in general practice just because they're so sick that they have to go straight to hospital. It's difficult, though, to pick up who's a sick child or not. So this is some really good guidance from the UK Sepsis Trust, things to look out for children. And that's really sort of looking how they are. Are they breathing really fast? Have they had a fit or a convulsing? Or do they sort of look mottled, bluish or pale? There may be a rash that when you sort of use a glass onto it, it doesn't fade away. And they're sort of a bit more lethargic or difficult to wake up. And sort of feel abnormally cold to touch. In these cases, we generally advise that you go to A&E setting to get them assessed, with the idea being, could this be sepsis? In children under 5, this can be a bit more tricky, and there may be some vaguer symptoms that they have got, such as if they're not feeding, they've been repeatedly vomiting, or if they've not passed urine in more than 12 hours. And any of these, it may be worth either contacting us or calling 111 and just ask, could this be sepsis? So finally, with tonsillitis, the big question is, do you need antibiotics or not? And the majority of the time, I'd argue, probably not. But we generally look at 5 things, such as, have you got a fever in the past 24 hours? If you haven't got a cough or cold symptoms, and this is a big one for me, I'm seeing a lot of kids with sort of snotty noses, a bit of a cough, and they've got a sore throat as well. And in those situations, the majority of the time, it is viral, just by the sheer fact that they've got this snot streaming down and this cough going on. Symptoms should be fairly rapidly onset, so any more than 3 days, it's very unlikely to be bacterial. And also looking at the tonsils themselves, they need to have a big white, loads of pus on them, and also be severely swollen. So we take those 5 sort of symptoms and we score them, okay? If you score 0 to 1, you don't need antibiotics. Generally, it's most likely viral. If you score 2 or 3, you may need antibiotics, but in these situations, we'd sometimes offer a delayed script, so a script that you pick up in about a day or 2. And, generally at this point, whether it's viral or bacterial will generally show itself. Finally, if you're getting 4 or 5, again, it might not be bacterial, but there's a good chance it is, and we should really be offering antibiotics. So I hope you found that useful. In this video, we've covered 3 broad areas, a bit about Group A Strep, a little bit on spotting the sick child, and finally a bit about tonsillitis and when we should and shouldn't be offering antibiotics. Really, hopefully that makes you better informed. If you've got any comments, questions, by all means, get in touch with us and we'll try and do our best to sort of see everyone. As you can well expect, the media coverage and people's understandable concerns has meant that our demand has gone up. So we'll try and do our best to sort of get to everyone as best as we can do. Dr. Dave Hindmarsh of Eaglescliffe Medical Practice. Please feel free to share this amongst your family and friends if you feel that it would be useful to them, and I'll see you soon. Many thanks.